All right. Very nervous about this. Got a couple of stories to tell you about pertaining to this vaccine. Okay, so let's get into it. Raw news, live and uncut.
A COVID-19 survivor has quite a story to tell, and he is telling it exclusively to KHOU 11 News. Anthony Jones was intubated in the hospital, and when he regained consciousness, his tongue was so swollen he couldn't close his mouth. So he came to Houston for treatment for this rare side effect. And we want to let you know some of the images are graphic. Stephanie Whitfield reports.
After the year he's had, Anthony Jones is grateful to have a smile on his face. Jones got COVID-19 in July. His wife says he spent 3 weeks in intensive care on a ventilator.
They were trying to heal his lungs. His lungs was messed up real bad. So they had to turn him on his stomach for 12 hours.
Doctors say being in the prone position, lying face down, helped his lungs because of extreme swelling in his tongue. He lived like this for 3 months.
They was like, I don't know what to do with it. Nobody knew what to do with the tongue.
But a specialist in Houston did. Dr. James Melville with UT Health had treated the incredibly rare condition called macroplasia before.
Actually, twice before. We wrote a publication on him. That's how Anthony's mom found us.
Melville operated a few weeks ago. The before and after pictures say it all.
He's cured. His speech will get better and better. And I gave him cream of light today. And he can taste every one of them. He's going out to Texas barbecue for that.
He says the benefits of the prone position outweigh the risks for critical coronavirus patients. But it may lead to more cases of this rare side effect. And if that's true, this COVID survivor wants others to know there is hope.
I kept the faith, and change went the way they're supposed to go.
Stephanie Whitfield, KHOU 11 News.
Okay. My thing is, like, I believe he was vaccinated and things went horribly wrong. That's what I believe. Things went horribly wrong and they had to think of something quick. All right. That's what I think went wrong. Okay. When it came to that. Anthony Jones, who was from Florida, came to Houston for treatment after his tongue became so swollen he couldn't close his mouth. This story is something that you have to see to believe. A man in Florida was critically ill with COVID-19. When he regained consciousness, his tongue was so swollen he couldn't close his mouth. Anthony Jones of Lake City was hospitalized with COVID-19 in July. A day later, his wife, Gailey, says he was placed on a ventilator. They were trying to heal his lungs, Gail said. His lungs were messed up really bad. They had to turn him on his stomach for 12 hours. Lying on his stomach helped his lungs, but caused extreme swelling in his tongue. Jones lived like that for 3 months before his mom found a specialist in Houston who knew how to treat the rare condition. Extremely rare, said Dr. James Melville with UT Health. I think out of a literature research for his situation, we found one more case, so 2 out of the whole pandemic. But Dr. Melville with UT Health thinks there may be more since many COVID patients are placed in this prone position now. If that's true, Jones wants others to know there is hope. Sorry, I just don't believe this story. I really don't. I think they gave him the vaccine and his tongue got swollen. That's what I believe what happened. But let me show you something else, what's going on with Pfizer. Okay? Look what they're doing. Look what Pfizer is doing. And I'll read it to you. Pfizer's CEO cashed out 6% of his stock on the same day the company unveiled the results of its COVID-19 vaccine trial. Why would you do that? Why would you do that? Why would you cash out your stocks? Pfizer CEO Albert Bourla sold 62% of his stock in the company on the same day the drug maker announced the results of its COVID-19 vaccine trial. Bourla sold 5.6 million in stock on Monday as part of a predetermined trading plan adopted August 19th. His stock sale was carried out at 41.94 a share. The 52-week high for Pfizer stock is $42.99, which means the CEO cashed out his shares at close to their highest price this year. Pfizer and its German partner BioNTech on Monday became the first to post positive results from late-stage COVID-19 vaccine trials. Pfizer CEO Albert Bourla sold 62% of his stock on the same day the company announced its experimental COVID-19 vaccine succeeded in clinical trials. The vaccine announced sent Pfizer's shares soaring almost 15% on the day. Bourla sold 132,508 shares in the company at an average price of $41.94 a share, or $5.6 million total, according to filings registered with the Securities and Exchange Commission. The 52-week high for Pfizer's stock is $41.99, meaning Bourla sold his stock at almost its highest value in the past year. His stock sale was carried out through a routine Rule 10b-5-1, a predetermined trading plan that allows company staff members to sell their stock in line with inside trader trading laws. Bourla's sale was part of a plan adopted August 19th. The filing showed that he continued to own 81,812 Pfizer shares. Pfizer confirmed that Bourla's stock sales were part of a plan that allows major shareholders and insiders of exchange-list corporations to trade predetermined number of shares at an agreed time. Through our stock plan administrator, Dr. Bourla authorized the sale of these shares on August 19, 2020, provided the stock was at least a certain price, a Pfizer spokesman told Business Insider. On Monday, Pfizer and his German partner BioNTech said that their COVID-19 vaccine was found 90% effective in preventing illness based on 94 observed cases in a trial with thousands of participants. The pharma firms are the first to report positive results from late-stage COVID-19 vaccine trials. Pfizer is already working on a work-around powder form vaccine to address the current one's biggest limitation, having to be stored at extremely low temperatures. The vaccine, which involves 2 doses administered 3 weeks apart, won't be distributed immediately, as it still needs to be evaluated and approved by the U.S. Food and Drug Administration. Interesting. Read more. Biotech execs hunting for COVID-19 vaccines and treatments have ranked in more than $1 billion by selling company stock this year. Here are the 27 leaders who've cashed in the most. It's interesting. That's very interesting. So you sell yours things go bad, nothing really bad could happen to you. Hands are clean. Biotech execs hunting for COVID-19 vaccines and treatments have ranked in more than $1 billion by selling company stock this year. And here are the 27 leaders who have done it. Okay. Let's go down. Okay, come on. Okay, here they are. Regeneron billionaires, co-founders Leonard Schaefer and George Yakanopoulos. Let's see if this is coming up. Okay. Sorry about that. I just want you guys to see what I'm seeing. Okay, here we are. Something that's very, very interesting, man. All right. So this is basically it. These two people are the ones who have cashed out the most with this. I can't get more information. I have to be a subscriber to this. So that's more about these. Okay. If you're interested in being a business, into Business Insider, fine, you do that. But this is where I'll go on to the next stream to show you guys more. Here's some more stuff about this COVID-19. Okay, and here we are. All right. Just having a little problem here. Okay. All right. It's good now. Sorry about that. People of color must be prioritized for the COVID vaccine unless we want history to repeat itself. What do they mean by that? Okay. So they're saying that non-whites have to be first in line to get jabbed. The good news is that Pfizer has said its new COVID vaccine is 94% effective based on the results of their phase 3 trial data. What does that mean? The research also provides encouragement for the Black and ethnic minority. With 42% of participants from diverse ethnic backgrounds, this level of protection matters for all, but especially for individuals from the Black community, as they have been disproportionately affected by COVID in terms of infection and fatalities. Deaths during the first wave of the pandemic were not spread equally, as Black men were nearly 3 times more likely to die as a result of contracting COVID than their white peers. For Pakistani men, the increased risk of death was double, and for Bangladesh men, it was 2.5 times that of white men. Black women were also at increased risk of death due to COVID compared to white women. Rather than view this as a result of some genetic difference, the inconvenient truth is that this elevated risk is due to racism. Although in theory the NHS should offer services in a free and equitable way, this is not the experience of some from the Black community. The root into healthcare and then onto treatment is riddled with discrimination, some of it overt and some of it subtle. People from the Black communities can be reluctant to seek help with COVID, in part due to the lack of services in areas where they live, but also due to perception that they won't be offered the same care and treatment as their white counterparts. So they want us to be first. Like I said, okay, when this goes through, when it comes down the pipe, those blacks who are on public assistance, those are the ones that are going to be first, okay, to get that jab, to get tested with this experimental vaccine, okay? They're the ones to get it. They're the ones that are going to be have to deal with the backlash of it, because this vaccine is untested. Not untested, but it's not properly tested. A vaccine takes at least 10 years to be tested before it's given to the public, not some mere 6 months. Because COVID-19 came out in 2019. Okay? And let me give you some history on this COVID-19, which is really SARS-2, severe acute respiratory syndrome. Okay, this was in the Middle East. Okay, and it made its way into a Canadian laboratory where 2 Chinese spies got a hold of it, brought it back to their government, and thought it was a good idea to experiment it in the wet markets of China. And that's when it went out of control. The Chinese government couldn't contain it anymore and couldn't lie that they had it under control. And it spread everywhere. That's what happened. Okay? I have information on that. I have it on audio. I recorded it. On my audio podcast, I will leave it in my description box if you want to listen to it. The ex-president of Iran talked about it. Ahmadinejad, he talked about it. Okay. I'm not going to say any more because then I'll just get hit with a strike by YouTube. And that's about it. Talk to you guys later.